Okay, let's see if we can get this over to Facebook. Computer's moving a little slow.
Mm-hmm.
So while we're waiting, I'm just prefacing this video. It's Wednesday, October the 28th. And I have a guest on with me while we're trying to get on to Facebook. Come on.
Oh, now since your group is a private group, are you able to share this on my page?
I'm gonna try, yeah.
Okay.
Come on. Oh, that music is so beautiful.
Mm-hmm. It's nice.
Let me see if I can get this set up while we're waiting on Facebook.
Okay.
It's taking this time to come through. And come on, dude.
Yeah, that was good that you started a few minutes early.
Yeah. I don't want Microsoft Edge. All right. Come on. I'm gonna switch this over. Oh, this is annoying. Record it. There we go. Okay, so it is recording. So we're trying to go live on Facebook, but we're having a little bit of technical difficulties. But I'm excited to bring this information to you tonight and this guest. For those of you that don't know me, I'm Shirley Banks. I'm also known as Food Girl 29 on Instagram. And I'm on Facebook as Shirley Banks. And I have a Facebook group that's a private group that's called SB Wellness Forever Young. I have an awesome, amazing guest with me tonight who is going to be sharing some wonderful information that I think we're live, right? Yeah, checking connections. Oh, what's going on? Okay, it says we're live on Instagram. Okay. Oh, this is disappointing. Hang in there, guys, hang in there. Restore pages. Okay, we're getting into Facebook, so you have to excuse the blank screen for a minute. going to be some good content, so just stay tuned, listen to the music. Excuse my blank screen. Facebook is pulling up really slow. And I do apologize for the delay, Dr. Keats.
Oh, no worries. It's only 5 minutes after, so no worries. Still early.
I don't know, maybe if it's my end with my computer or is it Facebook? Okay, come on screen. So I hope everybody had a good Wednesday. Let me get a title here. I have to give Facebook a title. So tonight we're going to be talking about cancer prevention and treatment. This music is very calming, so it's very peaceful to have something to relax your day. When you have a busy day and when you have stress and things get technology to work for you, it's always good to have some relaxing music. So I do apologize for the delay. As soon as Facebook gets connected, because we're going to get started with our content. We won't be with you long, maybe about 30 to 40 minutes. So go live. Okay. I'm not sure why it keeps going back over to this.
Oh, I see a message that says it's now streaming live on Facebook.
Oh, you see it? Okay.
I do, yeah, it just popped up live on
Okay.
Facebook.
All right. So make sure that we are recording. Okay, so it's live on Facebook. Okay, it says it's recording, so let's hope, yeah. Okay, all right.
Okay.
So Instagram, we're live. Facebook, we're live. It is Wednesday evening, October the 28th. And I'm so excited to be bringing this information with you tonight with my guests. And I know I'm gonna thank you if you've been waiting for some content to come up. Okay, great, thank you. So we know that this is Breast Cancer Awareness Month. And in 1971, a war was declared on cancer by a former president, President Nixon. And he signed into law the National Cancer Act. And this act, let me get rid of this music. I do apologize. We can get rid of that now. This act was to find a cure by increasing research, to understand the biology of cancer, and actually to have more effective treatments and to reduce the death rates of cancer. However, we're right now in 2020, so many, many, many decades later, and we have not reached that ultimate goal of victory because every day we're seeing increasing diagnosis with cancer. And let me just get that out of the way. With lung cancer, breast cancer, and colorectal cancer being the major cancer links that are coming. And so tonight we're going to be talking about this. So October, we know, is Breast Cancer Month. And for those of you that don't know me and that maybe view this later, if you can get rid of this pop-up here. All right, goodness. May view this later. I am Shirley Banks, and I am a registered nurse as well as an integrative nutritionist. And we have on the line with us Dr. Keats, and she's going to introduce herself in a few minutes. But I've been doing in my Facebook group, really, I've been doing in my Facebook group some education, and I've been actually having some interviews with women who are actually dealing with breast cancer and their journey. We also did some information on the BRCA gene, and maybe that's going to be brought up tonight too, as Dr. Keats go into the information. And so we want to honor those women who are, still fighting with issues with breast cancer. And even, men have breast cancer. And about 7 years ago, I did a Blog Talk radio show, and somebody reached out to me, a gentleman, and he was like, men? I'm like, yes, men. It's a small percentage, but men do have breast cancer. So you want to make sure that, men pay attention to this as well. Pay attention if it's not for you, for your daughters, for your wife. And if you yourself are suffering, I think this is going to be some good information that we're going to share with you tonight. Now, just a few disclaimers before we get into the information. This is for education only. This is in no way telling you how to manage your diagnosis, what to do about your diagnosis. We are healthcare professionals, but we are not assigned to you. We're not your doctor. We're not your nurse. We're not your nutritionist. But we're going to share some information that I think could be beneficial to you. Maybe you can formulate some questions around any concerns that you may have. And then as well, talk to your doctor about some of the things that were discussed tonight if you find that interesting for you. So hang in there. Instagram, thank you for hopping on with us. Facebook, thank you for hopping on. Now, I'm excited to have Dr. Keats with us. And she's going to tell us a little bit about herself, but just stay tuned. So grab your pencil, grab a piece of paper, a matchbook or something. You need to write something because the information that's going to be shared is going to be beneficial and it could be life-saving. So I really want you to take this conversation seriously. We set this aside as time because we know this information. I know it. She knows it. We set this time aside for you. So I hope you will take advantage of the information that we're going to share tonight. Okay. So Dr. Keats, if you just introduce yourself, tell them who you are, where you're located, all of that good stuff.
Sure. So my name is Dr. Amina Keats, and I'm a licensed naturopathic doctor and board certified in naturopathic oncology by the American Board of Naturopathic Oncology. And I actually have 2 telehealth practices at this time. I have a, I have a practice at an integrative center in Bethesda, and I also have a practice at Maryland University of Integrative Health, a natural care center there. And I also work as a faculty member at Maryland University of Integrative Health. And so at each of my practices in Laurel and also in Bethesda, I do specialize in integrative oncology care. I would say probably about 80% of the patients that I see in my practices do have a current diagnosis of cancer or past medical history of cancer.
Now, most people have not heard of the term integrative cancer care. Can you elaborate a little bit more on that?
Sure. So integrative cancer care is actually a general term, and you may hear different definitions from different providers and even different definitions from patients as well. But when I say integrative oncology care, the idea is that you use multiple tools to fight cancer, to inhibit the metastatic spread of cancer, and to prevent cancer. And so this could include conventional medicine. This can include naturopathic medicine or natural medicine. This can include things like acupuncture, massage therapy, again, using all the tools that we have available to confront the diagnosis.
And, I see that as an evolving thing because normally, years ago, that was not, it was just, this is the way it is. But I'm glad to see now that there are things like Cancer Centers of America are coming and bringing and incorporating all of these other modalities in to support women and men as they're going through. So even though this is Breast Cancer Awareness Month and we're primarily focusing on the breast, but a lot of the information that Dr. Keats is going to be sharing can be incorporated in almost any cancer diagnosis. And even when we go into the preventative piece, that could be a life, it doesn't even have to relate to cancer at all. It could be diabetes, it could be hypertension, it could be a myriad of other diagnoses that you may have or are concerned about. And so I want you to really kind of pay attention and kind of listen in to see what she's going to be sharing. So, is cancer preventable?
So there are certainly many things that we can do to reduce our risk of cancer, breast cancer and other cancer types. So I would say the answer to that is yes. There are modifiable risk factors that we have control over, that we can shift. And then, of course, there are non-modifiable, but what I like to focus on are the modifiable risk factors so that we can do all that we can to prevent any kind of cancer diagnosis.
Mm-hmm. And even, let's say, what the things that are, what would you say non-modifiable? I mean, I know we can't do anything with age or our, whether you're male or female.
Right,
yeah.
Right, exactly. So sex, like you said, we know that women are obviously diagnosed, right, at a higher rate versus men. As we age, there's an increased risk. Genetic factors, especially genetic mutations that are inherited, like you mentioned, BRCA1 and BRCA2, for example. Mm-hmm. There's been some connections between women who are taller having a slightly increased risk of breast cancer, which is really interesting. I don't know if anybody knows the exact.
Yeah, that's interesting.
That is interesting. If there's a personal history of breast cancer, if there's a family history of breast cancer, those are the kind of things that we can control. But again, there's certainly a number of things that we can.
Was there any information about why the taller women would be more?
I didn't see that. And I don't know if anyone knows the answer to that. It is a very slight kind of increased risk, especially compared to the others. But that information is there.
Okay. So we know that we can't change our age. We can't change our sex. We're female, you're male, whatever. I know now they're putting on some things unknown or whatever, but you can't change that. But there are things that you can change. And even if you've got a genetic predisposition, like the BRCA gene, BRCA1, BRCA2, that you can't just say, because those things actually can be worked with. And I just did an interview last week with a young lady, and Dr. Keats, she was told that primarily her choices were, she had the BRCA2 gene mutation, that primarily her choices were she could have a radical mastectomy, or she could have, they could monitor her every 6 months with mammogram and MRIs. Mm-hmm. That those were her choices. So how would you, when we discussed this a little bit, we talked about some of the things that she's going to employ, because she kind of have a different mindset that, like if she could, even though she has a, not necessarily, I want to say, I know her mom was BRCA positive too. Yeah. But her mom was much older, and so she's deciding that she's going to do some things to tweak her health. So let's talk about, in the prevention phase, even if it wasn't BRCA and it was just me or my niece or whoever, what are some of the things that we can do as women and as men to prevent cancer?
Yeah. So, before I jump into that, a light bulb just went off in terms of the mutations. And so I think about epigenetics, right? So this whole idea of you may have a genetic predisposition, but there are certain lifestyle kind of factors that you can put in place to turn those genes on or off. So I just wanted to mention that. With the BRCA mutation that we just mentioned. So in terms of those modifiable risk factors, those risk factors that we have control over, number one, I would say would be alcohol intake. So there have been studies showing that increased alcohol intake does increase the risk of breast cancer, and not necessarily having a whole lot of alcohol. I'm referring to having like one serving a day can actually increase your risk by about 7 to 10%. And of course, as you can imagine, as those servings increase, the risk does increase as well. So, alcohol, the main reason, or one of the main reasons why it's linked to a breast cancer risk, is that it does increase estrogen levels. And we know that estrogen can stimulate the growth and proliferation of breast cancer cells. So that's number one. The second thing that I think about when it comes to those modifiable risk factors would be obesity and being overweight. And so with obesity, that can lead to inflammation. And we know that inflammation can be a precursor to cancer, breast cancer, and other chronic conditions as well.
Mm-hmm.
The other thing is that with the accumulation of fat, leads to increased estrogen levels as well. So just thinking about weight control can actually help to reduce the risk of breast cancer. And with that, increasing physical activity. So there have been links made between inactivity and an increased risk of breast cancer. And when we talk about this physical inactivity and obesity, this has actually been seen more so in menopausal women in terms of that increased risk, which is interesting, but still some benefits in that premenopausal category as well. Some other things that I think about in terms of modifiable risk factors would be things like birth control. So there is a slight increased risk with birth control pills and some of the shots like the Depo-Provera shot, which is a progesterone injection, with intrauterine devices, especially if they excrete estrogen or release, release hormones. Mm-hmm. And then even with hormone replacement therapy, especially if taken over a number of years. So for example, more than 4 years. But the thing to remember with birth control and hormone replacement therapy is that once those hormonal therapies are discontinued, that risk does decline or go away over time. So it's not a permanent risk that you carry with you, which is, very positive.
That's good.
But those are the main kind of modifiable risk factors. And, of course, I have to mention nutrition, right? Nutrition is huge, right?
It's huge.
Yeah. That should have been the first thing on my list, but yeah, nutrition is pretty significant too. So there's a lot that we can do. Not only the type of foods that we eat have been associated with reducing the risk, but also the timing of our meals as well. So there's a lot of opportunity when it comes to nutrition and eating.
Can you elaborate a little bit more on the timing? Are you referring to like autophagy or intermittent fasting?
Yeah, exactly. Intermittent fasting. So most of us, think about intermittent fasting is popular, for weight loss and maybe some other things. But studies show that intermittent fasting for 13 hours or more not only reduces the risk of breast cancer recurrence, but can also help to reduce mortality related to breast cancer. So that's number one. Intermittent fasting for at least 13 hours overnight. And during that fasting window, of course, having things like water and unsweetened tea is fine. The other thing when it comes to timing is having that last meal or snack at least 2 hours before bedtime. So even if you are intermittent fasting, making sure that you're taking that last meal before, at least 2 hours before bedtime, that's been associated with a reduced risk of not only breast cancer, but prostate cancer as well. So those are the two kind of timing prescriptions that I recommend to almost every patient that I see that has a history of breast cancer or a current diagnosis of breast cancer.
Mm-hmm. Mm-hmm. Now, I'm a big proponent for nutrition too. Yeah. We're a food first kind of person. And so even with good nutrition, let's see what we got. Okay, thank you. Good nutrition, there was something. And we're talking about prevention now. So we're talking about prevention. How, because I was surprised, well, not surprised, but talk about stress and emotional health as it relates to prevention, not just, but overall.
Yeah. So that's huge. That's huge. And I think that a lot of us ignore that piece. So even if you are eating healthy and exercising and doing other kind of right things, if your stress levels are elevated, it's really going to slow you down from that health goal. So What happens is when stress levels are chronically elevated, we have these stress hormones that become elevated, especially cortisol. So ordinarily, cortisol is healthy and fine, and we need it for survival. But when cortisol becomes elevated and stays high because we are stressed about work or a home or COVID or finances or politics, et cetera, that's when it really has a negative impact on our health. So for example, it can suppress immune function. Obviously, we need optimal immune function in order to prevent cancer and infections and other kind of things, right? The other thing is that cortisol can increase certain hormones like insulin. Now, insulin can act as a growth factor to breast cancer. The other thing is that cortisol can also have an impact on melatonin. Melatonin is secreted at bedtime and has a lot of wonderful benefits, like it's an antioxidant, also important for immune support, also important for cancer fighting support. So long story short, stress management is very important and really should be the foundation of any treatment plan when we're talking about prevention or active treatment as it relates to breast cancer. And there's a lot of things that we can do for stress management. And I can talk about that now, or I don't want to get ahead of myself.
Yeah, go ahead and just elaborate and give us like 3 points, because
I
do want people to kind of take away from this, because, and the reason behind that, and we're talking about prevention, but a lot of these things can be actually related to if you're actually dealing with that diagnosis too as well. And especially in breast cancer, that was one of the things that I read. I remember when I was in nursing school and we talked about the type A personality and how that affects the body, and you know, how they were more prone to heart disease and blah, blah, blah. Well, I read some information that talked about with women with breast cancer, that is a lot of time too is relationship, unresolved emotions. And I don't know if you've read that piece about, you know, and it could be anything from grief to unforgiveness, whatever, and how that lodges in certain parts of the body. But I know that if your stress is not managed because you've got these unresolved emotions, not that the unresolved emotion is giving you, but it's elevating your stress levels, which is releasing the chemical throughout your body, which is doing the damage. So talk to us a little bit about some of the things that you encourage your patients to do, your clients to do as far as stress management.
Sure. Yeah, that physiological impact is really significant. Yeah, so there's a lot that we can do. And of course, it depends on the person and kind of what kind of stress they're experiencing and where that stress is coming from. But in general, meditation can be effective for stress management. Exercise can be effective for stress management. Volunteering or helping other people can help to reduce stress levels. In terms of supplementation, there's a category of herbs referred to as nervine herbs, which help to relax us, helps to reduce cortisol levels, helps to calm us down. And so within that family, there are things like chamomile and passion flower and lavender and even spearmint. Now, there's another family of herbs that are specifically indicated for stress management, and that family is referred to as adaptogenic herbs. And probably the most popular and one that many listeners have heard of before is ashwagandha. So ashwagandha is a great adaptogenic herb, very popular, especially during these difficult times. Now, ashwagandha can help to regulate cortisol levels. There's been lots of studies showing that it can help to reduce cortisol levels, can also help to inhibit breast cancer cell growth. So that's a plus. Helps to reduce anxiety as well. So that's probably my favorite adaptogenic herb to use. But I would say those are probably my top recommendations. I mean, there's a lot that you can do, as I mentioned, but those would be my top recommendations when it comes to stress management. Another one actually would be magnesium. Magnesium can be very effective too. And then most of us are deficient in magnesium, so a lot of us need it anyway.
And I would just add to that, I'm a big proponent of journaling, your feelings, your emotions, finding somebody that you feel safe to talk to, you know, that you can explore these feelings with and share and release these information. And I love essential oils as far as relaxation too as well. And I find that helpful.
That sounds good.
Okay, awesome, awesome. So let me ask you, is cancer reversible?
So I would say yes, but of course it depends on the stage of diagnosis. It depends on the treatment that's being received. It depends on if there are other comorbidities in the picture, you know. So for example, if someone has a diagnosis of breast cancer and they also have high blood pressure or other inflammatory kind of conditions, diabetes, that's going to make, the cancer that's going to be make it more difficult to treat, basically. So I would say early stage disease when it comes to breast cancer, there's tons of curable cases with that. The other thing to think about when it comes to breast cancer and rate of cure or the probability of cure would be the subtype. So when there's a estrogen receptor positive, progesterone receptor positive, that's definitely less aggressive and more treatable versus like a triple negative. Not to say that triple negatives are not curable, but the hormone receptor positives definitely are.
Okay, so I know you're, and I remember one of my clients that I was working with, and she was having a challenge with some of the things when she was going through chemo for her diagnosis, and we reached out to you for a consult because she was having a really bad reaction to the chemo with some serious side effects. So talk to me a little bit about the multiple disciplinary approach of how you manage when you're having to deal with a patient that, the doctor, the oncologist, and you working alongside the oncologist. How do you manage that piece? I hope that purpose that.
Yeah, definitely. That's very clear. So I didn't mention this, but I worked at Cancer Treatment Centers of America for about 10 years. And so I actually worked alongside medical oncologists and other conventional providers for many years. And that was really the main objective of our practice there in terms of the naturopathic piece was to reduce side effects and improve quality of life for patients. And so when we think about, let's say, chemotherapy, because we know that there are different categories of conventional treatment, but when we think about chemotherapy, it can be effective in killing cancer cells, but chemotherapy does not discriminate, right? So it will attack those rapidly dividing cells. So for example, the gastrointestinal tract. And so with chemotherapy, you almost always see gastrointestinal kind of symptoms. So things like nausea or digestive discomfort. So in those cases, let's say for nausea, often the medical oncologist or nurse practitioner will prescribe an antiemetic or an anti-nausea medication. And the good news is that there are natural things that you can do at the same time. So for example, I do ginger a lot, whether that's in a capsule form or a tea form, or even ginger candies or ginger brews, the actual beverage. Sometimes patients may experience constipation with certain chemotherapy drugs, or even lose stool with certain chemotherapy drugs. And, there are different things that are effective for that. We do have to be careful about drug and herb interactions, but something that I do like to use in general, as long as white blood cell count is within normal range, is a good quality probiotic, because probiotics are definitely very healthy and important for the gastrointestinal tissue, nutrient absorption. Most of the immune system is actually located in the gut. So paying close attention to the gut is going to be important. So I love to recommend probiotics when I'm able to for the GI symptoms.
And if they're able to eat, and do you recommend the probiotic foods as well? Like,
Yeah, absolutely. So, the kombucha and the kimchi and the sauerkraut, the only thing is that I would say challenge that I think about is taste changes that may occur with chemotherapy or even with a cancer diagnosis. So, sometimes it's difficult for people to eat certain foods. So, but when they are able to, I definitely prefer to recommend the food forms, absolutely, of the probiotics.
And so talk to me a little bit more about, so I know you're working with them doing their normal treatment. So let's say they're on like the oral form, they're for 5 years, and
like the hormonal treatment.
Yeah.
I see a lot of women who take either tamoxifen or aromatase inhibitors. And so With tamoxifen and the aromatase inhibitors, the common kind of side effects that I treat and see is probably hot flashes for sure, and then also fatigue. Um, Now, with tamoxifen, it differs a bit in that there can be some cardiovascular kind of side effects, and then unfortunately, there is an increased risk of endometrial cancer with that drug. And with aromatase inhibitors, there's an increased risk of osteoporosis. So bone support with that medication is important. But I would say I treat hot flashes the most out of the hormonal therapies. And when it comes to hot flashes, there's a lot that you can do. Now, on the conventional side, there's not so much that's advised for that, from what I've seen over the years. But for hot flashes, you can do things like ground flaxseed. I recently received an email from a patient saying, I'm taking 2 tablespoons of ground flaxseed and my hot flashes are so much better. You know, something so simple. You can do things like vitamin E or black cohosh. You know, of course, it depends on the patient. Again, we want to make sure that there are no interferences with the medications.
With the medication.
But yeah, there's a lot that we can do for hot flashes and fatigue and some of the other things that come with that treatment.
That is awesome. That's good information. So it sounds like there are simple things that they can add, because I know when women receive a diagnosis like that, sometimes they're, rushed into decisions about what they need to do. And most times, cancers have been growing for some time. It just didn't start yesterday.
Right.
And so some people don't always know that there are options out there to help them, whatever treatment they decide, whether they go in the traditional route or what, that there's support out there for us. I'm glad that there are people like you who are integrative, who have that experience that can actually help them manage, because I've been on the other side where I've seen patients really, really suffer. And, I remember one time having a conversation with one of my clients, and she was going through chemo, and I went to meet her at one of her sessions one day. And while I was in the waiting room, I saw like candy and cookies and donuts.
Yeah.
And I'm like,
it doesn't make sense.
I say, why is all of this in here? And I actually ended up talking to the dietitian at the center, because I said, I'm a little confused, She said, well, we just want them to have calories. And if, we just want them to eat. And if there's something here, they can easily pick up a candy bar or a pack of cookies and snack on that while they're here. And it just didn't seem right to me. It just did not seem right at all.
I agree with you.
That was not the thing to do. But a lot of times people don't know how important it is. And even I think I put that in my notes somewhere. The American Cancer Society has recommended a plant-based diet.
Oh, wow.
So why would all of that stuff, not like a piece of fruit, maybe some nuts, maybe?
Yeah, exactly. Yeah.
At least give them options. It was all sugar.
Yeah.
Maybe the apples was gone by the time I got there. I don't know. I could be wrong, but I'm telling you what I saw and what really disturbed me because of what she was going through.
Yeah.
So I'm really excited that you were able to share this information with us. I'm trying to see here, what else did I have? If any questions have come up.
There is something else that I wanted to mention when it comes to prevention, if, now or maybe.
Please, yes.
Okay. So, the other big piece is sleep. Sleep is an important prescription when it comes to breast cancer prevention. And, we know that it's important to sleep in a dark and quiet room, with no lights, no electronics, dark and quiet. And then in terms of the length of sleep, it's ideal to have 7 to 8 hours of sleep. Studies actually show that having 6 hours or less or having 9 hours or more does increase the risk of breast cancer. So that sweet spot is between 7 and 8 hours in a dark and quiet room. So that's very important to remember. I think that a lot of us, including myself at times, I'm not good when it comes to going to bed when I'm supposed to, but it's important to remember that. I mean, it's not only important for breast cancer prevention, but also diabetes and cardiovascular health and immune support. So definitely important to emphasize.
Yeah, that, and it is hard to establish, well, what the bedtime, excuse me, the regime should be prior to going to bed. So, but
Yeah.
sometimes it's hard to follow that, turning all the lights off and the electronics off, chilling out before, calming yourself down before you actually get into bed.
Mm-hmm.
And so, yeah. But that's something that I think has to be reiterated and just kind of like, refocus every time, because
Mm-hmm.
it is a lot, and it's not just one thing. It's not just the nutrition, it's not just the sleep, but it's the combination, I believe, of all of those things, regardless of whether it's breast cancer, lung cancer, colorectal cancer, or any other kind of cancer, or even any other disease process, whether it's heart disease, hypertension, diabetes. All of those things play a role in how your body responds, because your body can recover. But
Mm-hmm.
let's talk about exercise a little bit and how important that is in the cancer care.
Yeah, exercise, sure. So exercise is definitely a prescription when it comes to breast cancer prevention. So as I mentioned, there are studies showing that inactivity does increase our risk, especially during the menopausal years. So the Center for Disease Control actually recommends that we exercise for about 150 minutes a week of moderate activity. But for those who of us, or who may be runners, or those of us who jog, that more vigorous kind of activity, 75 minutes a week is what is advised. Now, in terms of the why, when it comes to exercise, number one, exercise helps to regulate hormones like estrogen. It also helps to reduce fat, right, in terms of optimal weight maintenance.
Mm-hmm.
And then it also acts as a natural anti-inflammatory. So helping to reduce inflammation levels is going to be important for breast cancer prevention and other chronic diseases across the board. So definitely important to incorporate. So whether that is a fitness class at at a gym that's practicing COVID guidelines, of course, or YouTube or Beachbody, or taking a walk outside, just finding that exercise type that connects well with you is important to do on a regular basis. And again, like I said, exercise is a great opportunity to relieve stress as well. So a lot of great benefits for that.
Mm-hmm. Exactly. And talk to me a little bit. What are your thoughts on like a good multivitamin mineral enzymes for patients?
Yeah, so I like to recommend good quality multiple vitamins. I think that it's important in terms of just having that foundation, because a lot of times we are deficient in certain vitamins, minerals, and antioxidants. So a general rule of thumb, I would say, is to find a capsule, because capsules are more absorbable than tablets. And then also, look at the back of the bottle. And if there are terms there that you can't pronounce, I would say a no to that. So basically, you want to find a capsule that's very clean, so that you're getting all, even if you're eating a whole foods diet and you're eating all the healthy stuff, there still may be nutrients that are missing. So the multiple vitamins definitely a great foundation.
Mm-hmm. So I just wanted to bring this up too, because gut health is just so paramount for healing overall, regardless. And I know someone who recently had an antioxidant test, and they're on antioxidants, but their antioxidant level was very, very low because they're not absorbent. So if
Mm-hmm.
you could find things more like maybe sublingual,
Yeah,
things like that,
yeah,
that
yeah,
don't have to go through the gut, maybe
yeah,
that's
yeah.
a huge thing.
Yeah, that's a good point. And with that being said, there are certain specialty tests that could be done, like, it sounds like you're referring to like a micronutrient test, so that you can
Right.
see specifically what is missing. And then when you see something is missing, then you can kind of take a deeper dive to fix that. Another thing that I think about is a specialty stool test. So the stool tests that are available through these different companies now to take a really close look at the microbiome. And so looking at the good bacteria, the bad bacteria, how well you're digesting food, if there are inflammatory markers, if there is things like candida or parasites. So that's really the kind of gold standard in terms of fixing a gastrointestinal problem, if there is one there, because having that information, you can definitely individualize a plan. But without that being present, in terms of GI health, things like I mentioned, probiotics can be effective. Things like demulcent herbs can be very soothing and healing to the gut, especially if patients are experiencing things like acid reflux. So things like slippery elm can be beneficial, or marshmallow. And then for people who are having trouble with, like I said, acid reflux, but gas, bloating, this kind of thing, digestive discomfort, digestive enzymes are often a good thing and a helpful thing to add.
Okay, awesome. Now, I wanted to bring up this one thing here first. How important is vitamin D levels?
Yeah, I'm glad you said that. Essential. So vitamin, in my practice, each plan is individualized, but I would say that almost every patient that I see, I have to put on vitamin D3 because most of us are deficient in vitamin D. And so vitamin D optimal levels are associated with a reduced risk of breast cancer. So that is definitely an important thing to have on board for prevention. And so what I usually do is order 25 hydroxy vitamin D, the biomarker test, and have that measured 1 to 2 times per year to make sure that it's being dosed appropriately. So someone may need 2,000 international units a day or 10,000. It just depends on what your levels say. And then also getting sunlight. We know that getting sunlight helps to increase our D levels as well. But yeah, vitamin D3 is definitely very important when it comes to prevention.
Yeah, I know sometimes it might take a little bit more sunlight for us.
Yeah, absolutely. Yeah, African Americans tend to be, and people of color tend to be lower in vitamin D.
Yeah, we tend to be a little bit lower. And now that it's even those, people are not going to be out, we're getting into the fall, well, at least here on the East Coast, in other parts of the country. So if you're still in, places like Florida, you're going to still be able to get out and get that sun. But you can still get out and get some sun on your face and your eyeballs,
That's right.
To kind of help, get those vitamin D in. So let's say, for instance, and then we're almost done. Let's just say, for instance, someone just got diagnosed with breast cancer and they're trying to figure out, the doctors are telling them radiation, chemo. How would you tell them to support their body before they start that process? Or what questions would you have them ask their doctor?
So I think that number one, it's important to be clear on the side effect profile of the treatment so that patients know what to expect potentially. And then also understanding how they can be supported or treated if those side effects happen. The other thing is to understand the length of time that the treatment is prescribed for. So for example, radiation may be, depending on the type, may be prescribed for 5 days or 8 weeks. So that kind of information is going to be important. And then even with chemotherapy, is it going to be 6 cycles or 12 cycles? What does that look like? So those basic kind of questions are going to be important. And then when I work with patients who are receiving chemotherapy or radiation or hormonal treatment, again, I do focus quite heavily on the side effects. So, so I would definitely have that conversation and recommend supplements to help to support them. Now, before they actually start, some basic things that they can do would be a good quality multiple vitamin, like we mentioned. Now, I do want to mention that a multiple vitamin is not the safest thing to do during radiation treatment. So if that is the plan, then they should stop before radiation starts. But in general, a good quality multiple vitamin is safe and fine to do. And then also vitamin D, like we mentioned, if the level is low, and then a good quality omega-3 fatty acids. So the omega-3 is great foundation when it comes to providing anti-inflammatory support, healthy fat. So I would say those would be kind of the foundational supplements, and then implementing the things that we already talked about. So a stress management kind of plan in place, sleep hygiene in place, nutrition in place, and so so those are the kind of things that I think about. And then of course the treatment plan from my perspective would be more detailed as I understand what the specific conventional plan is.
Okay. And a lot of times I think too, people are given the conventional plan, but because we're integrative, they may not have all of that piece. And so that's why I'm so excited that you were able to come and give us some insight into how you as a doctor work alongside, whether you're doing traditional treatment or not, to help manage those symptoms and side effects that can come with chemo or radiation. I don't know that, is there anything that you do for pain at all?
So anti-inflammatories, I do recommend for pain. So things like curcumin, for example, which is extracted from turmeric. A lot of times I'll do that. And sometimes I'll do the omega-3 fatty acids. Sometimes I'll do things like bromelain, but just those general kind of anti-inflammatories I'll recommend for patients to take either alone or with a pain medication.
Now, for those of you that hopped on or don't know, we're in the state of Maryland, so just outside of DC. So Dr. Keats practiced here. So you want to give them, share your information with them in case somebody wants to reach out to you,
Sure.
with some questions or concerns. You're in this general area of Maryland, but you do you'd say you do telehealth. So are you able to see patients or outside of the?
So at this time, I've converted to telehealth 100%, excuse me. And so I do see patients from Tuesday to Saturday. And my website is Dr. Keats, drkeats.com. And so there's information about myself and my practice there, or if folks want to schedule an appointment. I'm actually offering free 15-minute discovery calls at this time. And so if people have specific questions about how naturopathic oncology or how naturopathic medicine can benefit their health specifically, you can schedule that free 15-minute call on my website. Our office number is 301-828-896. In terms of social media, on Facebook and Instagram, I'm at Dr. Amina Keats. And so I do Facebook Lives every Thursday, post a lot of information up. So feel free to visit those locations to learn more.
Could you just give your phone number once again? I'm sorry.
Absolutely. It's 301-828-8966.
Okay.
And then social media handles are Dr. Amina Keats.
That is awesome. And I just want to share with the 15 minutes, because 15 minutes is not a long window of time. Be specific. Come, this is my diagnosis. These are my questions. This is my medication that I have. This is my concern. So you want to make those 15 minutes optimal for you and for Dr. Keats. So she's not having to go through, my mama and auntie and all. Get to the point so that you can get the 15 minutes and you can decide, what, but I can tell you that the support that she can give is phenomenal. And, if you're having to walk through this, because I walked through with family members who went through chemotherapy and radiation. And, I wish I had someone, because at that time I was not a nutritionist, I was a nurse. And I was just basically, the traditional, conventional, how you did things. Even though for myself, I kind of did things a little bit more naturally, but I didn't have cancer. And one of the side effects that we saw with the radiation was from my family member didn't happen right then, but later on we saw some aortic stenosis that happened. So I just like to arm people with as much information as possible so that when you're going in to have your conversations with your doctor, that you're not rushed through an appointment, that you can get your questions answered, you can get your concerns addressed, and you can get your concerns addressed. And I want to thank Dr. Keats. I don't know if you have anything else you want to share, but I want to really appreciate you for hopping on with us tonight. I don't see any questions. Look, a few people had hopped on. I don't see any questions on Instagram. Hold on. And I don't see anything on Facebook. There's a couple of people watching. So hopefully you took some good notes, that those of you that hopped on, that you took some good notes. So if you want to leave with like 3 top things, Dr. Keats, to tell the people what to do.
There is something else that I wanted to mention when it comes to prevention.
Okay, there we go. Got too many electronics going.
Yeah. So 3 top things you said?
Mm-hmm.
Okay, so I would actually leave with 3 top nutrition kind of thing because I didn't talk about that in detail. So one, well, first of all, we talked about nutrition being important for breast cancer
It's
prevention,
huge, yeah.
right? So I would say my favorite kind of nutrition things would be number one, a Mediterranean diet. So Mediterranean diet has been associated with a reduced risk of cardiovascular diabetes, but also breast cancer. Mediterranean diet has been shown to reduce the risk of breast cancer. So that's going to be things like fruits, vegetables, legumes, whole grains, olive oil, wild caught fish, right? The other thing that I would, number two, I would say is the cruciferous family of vegetables is going to be very important for breast cancer prevention. So your broccoli sprouts, your broccoli, kale, your turnips, your radishes, your watercress, your bok choy. And then number three, I would emphasize would be the foods that are rich in carotenoids. So that's going to be those orange and yellow kind of vegetables, and even some reds like tomatoes, for example, are going to be a good source of carotenoids. Spinach is going to be a good source, but definitely carrots, sweet potato, squash, and those kind of things. So those are the 3 things that I would leave everyone with.
Okay. Well, I'm going to piggyback on a little bit of what she said, and definitely the one of the things with the Mediterranean diet was I found that a lot of, even though the diet, there's a lot, they're eating with family. There's a lot of support in that. So when you see that, is having that family support, having, whether it's not your direct family, but having a good support system.
That's socializing, right?
Huh?
And that's socializing,
That
right?
socializing, yeah, that's very important. That's going to help to keep down your stress levels and keep those chemicals, nasty chemicals, in balance. And when she talked about the cruciferous vegetables, that's going to help with your liver detox, because your pathway 1 and because what happens, all that crap where you're detoxing or whatever has to get out of the body in the stool or in the urine. And if it's not doing well in the liver, it's going to get back into the body. So you definitely want to do that. You can do that in a smoothie. You can do it in salads. You can even, there is even like sprouts and stuff. There's all kinds of ways that you can get them in. And there was other thing I was going to say. Vitamin D. Yeah, that's it. Vitamin D, especially in these COVID streets. Okay. All right. So Dr. Keats, it's been a blessing. Thank you so much.
Thank you for having me.
And we're going to end this now. And thank you so much. Have a good evening.
Thank you.
Okay, let me stop.